Hi friends, this is Sajina. Today we can see the miscellaneous antifungals. It is the last category of antifungals. They could not be placed in the above categories, so they are placed under separate group called miscellaneous antifungals. These include flucytosine, cyclopyroxalamine, morpholins, Whitefield's ointment, Castellani's paint, Barrow's solution, potassium iodide, selenium sulfide, haloprogin, triacetin, echinocandins, sulfonamides, milfoxin, probiotics, and nicomycin. First we can see flucytosine. Flucytosine is a synthetic fluoropyrimidine. It is mainly used for the treatment of yeast and phaeoid fungal infections. Phaeoid fungus means black fungus. It's a water-soluble drug and can be administered orally. The mode of action is that in our body, this flucytosine is converted to 5-fluorouracil, and this 5-fluorouracil can inhibit thymidylate synthetase enzyme. Thymidylate synthetase enzyme is necessary for DNA synthesis. Therefore, flucytosine, it can inhibit thymidylate synthetase, resulting in inhibition of DNA synthesis. It is having a narrow spectrum activity. It can be used for the treatment of cryptococcosis and chromoblastomycosis. Cyclopyroxalamine, it's an analog of pyridone. It is inhibiting the synthesis of fungal cell wall. It can complex with polyvalent cations, thus inhibit the metal-dependent enzyme system, which is responsible for the peroxide degradation in fungal cell. Therefore, peroxide degradation gets inhibited. It can also inhibit the transfer of an amino acid, that is leucine. At higher concentration, it can alter the integrity of cell membrane, resulting in the leakage of vital cellular components. It can also inhibit arachidonic acid cascade, so this drug can also be used as anti-inflammatory and anti-allergic drug. It has a broad spectrum activity. It is active against yeast, molds, a variety of gram-positive and gram-negative bacteria. They are mainly available as 1% cream and is commonly used as a topical agent against various superficial fungal infections. Cyclopyrox gel is effective against tinea pedis. Tinea pedis is a type of dermatophytosis. Drug can penetrate the nail, so it can be used for treatment of onychomycosis. Onychomycosis, it is the fungal infection of the nail bud. Cyclopyrox nail lacquer is used as a topical agent for onychomycosis and the concentration is 8%. Then seborrheic dermatitis of the scalp, that is the head. It can be treated with 1% cyclopyrox shampoo. Second one is morpholins. Amorphine has excellent antifungal activity. It is efficient against dermatophytes, phaeoid fungi, dimorphic pathogens. It's a topical fungicidal agent. It is inhibiting two separate enzymes. Mode of action is by inhibiting two separate enzymes. They are reductase and isomerase. Two enzymes are involved in ergosterol synthesis. Permeability changes occurs. It adversely affects the fungal metabolism, leading to abnormal chitin deposition, resulting in growth abnormalities. Effective against tinea and onychomycosis. The common side effects are local irritation, burning sensation, and erythema. Next is Whitefield's ointment. The mixture of benzoic acid and salicylic acid. It is in the ratio 2:1. Benzoic acid is a mild fungistatic agent and salicylic acid, it is a keratolytic weak agent. Both are combined to form Whitefield's ointment in the ratio 2:1. It is commonly used for the treatment of pityriasis versicolor. It's a superficial fungal infection, tinea pedis, etc. It is very effective and less expensive. Castellani's paint. This paint is carbol formulated by Aldo Castellani. And it's mainly, or the main ingredient is carbol. It is used for the treatment of superficial fungal infections. The active ingredient is phenol 1.5%. It was a first aid antiseptic. It is popularly used in the treatment of Tinea imbricata. It's a type of dermatophytosis. Barrow's solution, it is developed by Carl August von Barrow as an ear drop. Colorless solution, acidic mixture containing aluminium acetate. It is mainly used to reduce the swelling and to remove the debris in automycosis. Next is potassium iodide, more than 100 years old drug used for the treatment of chronic subcutaneous fungal infections. It contains or saturated solution of potassium iodide. It is the drug of choice for sporotrichosis, basidiobulomycosis. Sporotrichosis and basidiobulomycosis, these are subcutaneous fungal infections. Excess quantity of iodine, it can affect the thyroid hormone production. Thyroid gland stops hormone production, resulting in a condition called Wolff-Chaikoff effect. Here, potassium iodide inhibits the binding of iodine in thyroid gland. Periodic thyroid function test must be done during the therapy. So, it's a drawback of potassium iodide. It can affect the normal functioning of the thyroid gland. Selenium sulfide, it is used for treatment of pityriasis versicolor, dandruff and white pydra. It is mildly toxic and possesses unpleasant odor. Selenium, it is mainly available as 2.5% solution as shampoo for topical applications. Next is haloprogin. It's a synthetic topical antifungal drug. It is mainly used for the treatment of superficial fungal infections of skin, particularly athlete's foot. Athlete's foot, it's a type of dermatophytosis seen in athletes who are always wearing tight shoes. Cure rate is higher and relapses are less frequent and is mainly available as 1% cream, that is Halotex. Irritation and contact allergy are some side effects. Next is triacetin. It is mainly used for the milder superficial infections, mainly athlete's foot. It is available as cream, ointment and liquid. Echinocandins, these are analogs or the analogs of echinocandins are pneumocandins and papillocandins. Both are water soluble. Irreversibly inhibit the beta-D-glucan synthase enzyme. This enzyme, it is involved in the formation of glucan polymers. This glucan polymer, it is an essential component of fungal cell wall. Thereby, they are blocking the cell wall synthesis in fungus. Osmotic instability is the result and the final result is the death of the fungus. That is, they are inhibiting beta-D-glucan synthase enzyme, thereby inhibiting the production of glucan. As a result, the fungal cell wall synthesis is blocked, resulting in the death of the fungus. Three candins are caspofungin, micafungin and anidulafungin. They are active against Candida, Aspergillus, Histoplasma, etc. Echinocandins, they show paradoxical effects or Eagle phenomenon. That is, initially when an agent is added to the medium, the number of survivors drops. That is, initially when echinocandin is added into the medium, the number of fungal survivors drops. But after increasing the concentration of echinocandin beyond a certain point, the number of fungi that survive paradoxically increases. This is called Eagle phenomenon. Sulfonamides, it is used for the treatment of bacterial infection and also it is used for some systemic fungal infections. Then milfosin, MLT. MLT has antiparasitic activity. Antifungal activity can be seen against dimorphic fungus and has shown antibiofilm activity against Candida albicans and is having fungicidal effect. Next is probiotics. Probiotics, they can reduce the colonization of Candida on mucosal surfaces. Potential to sustain a healthy mucosal microbiota. That is, it helps to maintain a healthy mucosal microbiota. It can interfere with candida biofilm formation and hyphal differentiation. So probiotics are very important. Next is nicomycin, new antifungals, and these are having an inhibitory action on chitin synthase enzyme. This chitin synthase, it is involved in synthesis of chitin. Chitin, it is the structural foundation of fungal cell wall, thereby inhibiting the cell wall synthesis. That is, as there is no chitin, the cell wall synthesis will be inhibited or the cell wall will be defective. Nicomycin X and Z can be used against Candida albicans, blastomyces, dermatitis, etc. Then another substance which can be used for antifungal therapy is cytokines. You have already heard about cytokines. Cytokines mainly used for therapy are colony stimulating factor, interferons, and tumor necrosis factor. That's all about miscellaneous antifungals. Hope you all understand the session.